you have ACL surgery and you're going back to running and jumping and you're practicing your landing mechanics, but you still don't trust your leg, or when you land, it's pretty wobbly, we're gonna go over one exercise you have to be doing to help work on your landing mechanics and also your deceleration. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist, and co-founder of the Basketball Doctors. So when we talk about ACL rehab, one of the most important things you have to be working on is deceleration and landing before you do any jumping, running, or anything. And that means being able to stick a landing, being able to stop and control, because the majority of all ACL injuries occur with deceleration or landing. So meaning you're gonna jump and then you land, your knee buckles in or pivots, and that's how you tear your ACL, or when you're running and you stop into a cut. So those deceleration forces, maybe you're not low enough, there's a lot of factors, and that causes that ACL tear. So we really have to get that position pretty strong. So we've done videos in the past, you can click the link here, when we work on landing, on teaching you how to land and decelerate. However, one of the things that we see with some athletes is we'll teach them how to land, stick the landing here, but they'll be pretty wobbly, or they just can't get in that position, or they don't want to, or they feel scared in that position because the quad has to be really working. So one of the exercises we like to do is we like to get the athlete in the position that we want to end in and have them be comfortable there. Because like we mentioned before, when we talk about deceleration, we want to land in a position where we're not only bending at the knee, not landing like this, but also bending at the hip. So it's an equivalent of both a hip and a knee strategy. Too much of a hip is no knee bend. And what we see with a lot of people with ACL injuries, or recovering from ACL surgery, is when they land, I'll show you guys in the side view, their knees not bend too much and they're bending a lot from the hip. So that's too much of a knee strategy. Another time we see too much of a knee strategy, landing too much here. We want to have that balance before with those two muscles, the anterior chain and posterior chain, the quads, hamstring, glutes. So one thing we like to do is we like to get in that isometric position to really feed forward that position that we want to be in. So when we land, like I mentioned, we land like this. So we're gonna work in that position. So we'll use a wall here for support and then get off of it. So I'm gonna show you the regression and the progressions. So what we're gonna start off with is our foot's gonna be down here. Our back foot, I'm gonna be working my right leg, is gonna be against the wall. And I'm gonna go into this little lunge position. So in this little lunge position, my back foot has no weight on it, maybe like 1%, because I can't really put weight on it unless I lean all the way back. So it's just there for balance. And this right leg, I'm gonna bend it into the position that I wanna be in. So here, my knees align with my second and third toe. My foot is in a stable position. I have a big toe, little toe, heel in contact. My heel is not elevated. I'm stable. My pelvis is stable. My chest is slightly leaned over my knee. That way I can still move. So I'm using a hip strategy and a quad strategy. So it's gonna look something like this. Obviously my leg's not gonna be behind, but I'm gonna be bending here at the hip and the knee. Not just here, not here. So a little balance of two. So we get in this position, and I want to be in this position for 30 seconds. Once I get in this position for 30 seconds, feel comfortable here in 30 seconds, we're gonna slowly take off our leg from the backside. So I'm gonna, instead of just having the leg behind me, I'm just gonna have it just come off. So now I'm not touching the back wall. When I'm not touching the back wall, that's gonna really mimic that deceleration or landing with one leg. So it's gonna look something like this. My leg's here, free. I like to keep it slightly behind me, but I'm not touching the wall. I'm bending at my knee, and so you can see my quad is loaded, my hamstring, glute are firing. So I'm really forcing that position and feeling comfortable. My knee's not wobbling. I wanna be strong and stable. And this is important because you'll see a lot of people when they land from a jump, they won't use too much of their quads, so they're bending here. We want them to bend their hands, using their hamstring, quads, glutes. So when they get here, they're wobbling. So in order to really work on that, we want to get that athlete comfortable in that position. A lot of the times during rehab, they don't get comfortable in those deep positions where we want to land. So this is a good way to really get that quad firing, glute, hamstring, and teach them the proper positioning. So once again, use the wall for support at first. My toes just touching it. Once I'm able to do 30 seconds, 3 sets of it, then I let go of the wall. And then the biggest thing, I'm gonna show you guys side view too. My knee shouldn't go past my toes, but it should be kind of close to my toes, and I should be bending at the hip here. And I want to be in a position, I usually tell people, can you jump from that position? Like, am I be able to get in this position? Then jump off. If I can't, then I'm too low and I'm just gonna be not an athletic position. You wanna be in a position where you can move after. So when you land, you can push off side to side, move however you want. So really get comfortable in that position where I'm in this loaded position, get off my foot off the wall and stay stable. Ideally, I wanna use no wall at all, even from the get-go. So I'm just gonna get in this position here. So that's a little isometric position we like to teach our athletes to really get comfortable, before they even go into landing mechanics, before they go into deceleration. However, if you're going into landing, decelerating, and you're having trouble, it's like my leg's wobbly, I don't feel too strong, I don't trust my leg, just get the athlete getting in this position. Just get comfortable in that position where you're gonna land. Then you can even add some oscillations where you're here and then drop. And then hold that position for 30 seconds. So here, and then drop. So really get comfortable in that position. And then another progression I like to use to really make sure we're firing up is we get in this position, I use the back wall as support, and I'm just oscillating back and forth here. Back, up and down, up and down, up and down, up and down. Really get all this burning, feeling those muscles. That way when I land, I'm fired up and I feel in a good position and I'm gonna master that position. So those are the little progressions, regressions to kind of go over. First, start off against the wall, get comfortable in that position. Once you feel comfortable, take off this leg so you're not using that for balance. Remember, we're bending at the knee, hip, our knees almost along with our second and third toe. And then once that feels comfortable, then let's just do a little progression of a snap down where we start off tall, then we drop, and then we hold for 5, 10 seconds, maybe even 30. Then come up, I lost my balance there, and then come down. Once that feels comfortable, then we can even add some oscillations here, where we're just getting down, low, low, just getting that knee used to those forces, because when you're playing basketball, decelerating, the knee's always gonna start moving forward, so you gotta get comfortable and strong in those positions. Hopefully that was a lot of information. Hopefully you guys learned a little bit about that isometric hold position for landing and deceleration. If you guys have any questions about ACL rehab or need help with ACL rehab, send us a message, comment below. We work with a lot of athletes in person and online. The biggest thing is really work on this landing before you progress to anything. We see so many athletes that come to us after 6 months of rehab and they're like, I can't land, I don't feel comfortable landing from jumping. It's because they're progressing too fast. You wanna get the basics down. That way, everything just goes as smooth. So if you can't hold this position for 30 seconds, you almost have no business landing or jumping. So really get this down, then progress to every other activity. Hit the like button, share, subscribe with friends and family. And if you guys want us to cover any other topics within ACL rehab, comment below, and we'll try to shoot as many videos as we can. We are the Basketball Doctors. Let's ball for life.